which are given in almost all techniques of anesthesia. Now, what anesthesia I'm talking about? In local anesthesia itself is what? It's a technique. You use local anesthetics. Okay? In spinal anesthesia, you use local anesthetic. In epidural anesthesia, you use local anesthetic. In nerve blocks, you use local anesthetic. So these are the drugs which are given in almost all types of anesthesia techniques except of general anesthesia. Now guys, in local anesthetics, there have been questions coming on what, how the local anesthetic is entering the nerve and what is it attacking and what is happening and all. So whenever you give local anesthetic, it enters the nerve terminal in which form guys? In non-ionized form. Okay, the non-ionized form of local anesthetic enters the nerve. Okay, and after entering the nerve, it becomes ionized, and after becoming ionized, it goes and searches for its friend. What is the friend guys? Sodium channel. Very very important. The mechanism of action of local anesthetic is to block the sodium channel. Usually it can block the potassium, calcium also, but mainly it blocks what? It blocks the sodium channel. And once the sodium channel is blocked, you know what will happen? Depolarization is gone, action potential is gone, and pain is also gone. So remember, that's the main mechanism of action of local anesthetic. So what are the nerve fibers which are sensitive? Remember guys, it is the A followed by B followed by C fibers. Okay, in A also which fibers guys? Gamma, delta, beta and alpha. In A also it is GDBA, gamma, delta, beta and alpha fibers. Now guys, in local anesthetics, we also need to remember the classification of it. They are classified into two categories. One is called as amino amides, other is called as amino esters. Remember guys, amino esters, how to identify it? There might be some questions, but very easy guys. Amino ester, if you look at the spelling of amino ester, how many alphabets of I are there? Only one alphabet of I, sir. If only one alphabet of I, all amino esters will have one I. Examples: cocaine, procaine, tetracane, proparacane and benzocaine. These are what guys? These are amino esters. Okay, remember guys, cocaine is a local anesthetic. Remember, cocaine is a local anesthetic that causes vasoconstriction. Very very important. Very very important. Remember, usually all local anesthetics will cause some degree of vasodilation, but cocaine is a potent vasoconstrictor. Due to this fact, you will see that once the patient is a cocaine abuser for a long period of time, either he will land up into hypertension or either he will land up into stroke. Why? Because cocaine is a potent vasoconstrictor. Okay, that's a very important point of cocaine. Now procaine is there, benzocaine is there, tetracane is there and proparacane. Proparacane is the most commonly used ocular topical local anesthetic. Ocular topical local anesthetic, that is proparacane. Okay, next, coming to the next category guys, which is called as aminoamides. Guys, again, the first MCQ that could come is identify which is aminoamide. Amino ester. Aminoamide means what? Amino ester was having one eye. Aminoamide will have two eyes. Two eyes means what are the examples? Lignocaine, aminoamide, mepivacaine, bupivacaine, ropivacaine and dibucaine, all are having two eyes, and these are aminoamide local anesthetics. Okay, the other name for lignocaine could be xylocaine or lidocaine, but remember, don't get confused, sir. In xylocaine it is one eye. Xylocaine other name is what? Lignocaine, it's having two eyes. So these are aminoamides. Now in this, you need to remember the most commonly used local anesthetic worldwide. It is what guys? It is lignocaine. Most commonly used local anesthetic in spinal anesthesia is bupivacaine. Okay, so this was regarding what? The classification. Now you also need to remember longest to shortest acting local anesthetic. Now, which is the longest acting local anesthetic and which is the shortest acting? For that, the mnemonic is what? Delhi to Bombay loves PC. Delhi to Bombay, D stands for what? Dibucaine is the longest acting local anesthetic, but it is the most toxic also, hence not used. Next, second longest acting is what? Tetracane. Tetracane is the second longest. Again, it's also having toxic effects, not used. Shorter than tetracane is what? Bupivacaine. Bupivacaine is the most commonly used, pardon my spellings guys, okay, it's the most commonly used local anesthetic in what? In spinal anesthesia. Despite knowing the fact that bupivacaine is cardiotoxic, it is the most commonly used in spinal. Okay, we'll come to it later. Next, L stands for lignocaine, most commonly used worldwide. Okay, P stands for procaine, shorter than lignocaine is procaine, and the most shortest is C, that is nothing but chlorprocaine. Chlorprocaine is the shortest acting local anesthetic. Okay, now regarding procaine, you need to remember procaine is the safest local anesthetic used in malignant hyperthermia, and chlorprocaine is the shortest acting local anesthetic that we have already discussed. Now guys, there have been questions asking you about which local anesthetic produces allergic reaction. There are some categories of local anesthetic. When we give to the patient will have itching, rashes and all. Which local anesthetic? If someone asks you and he tells you the option amino ester or amino amide, always remember guys, amino esters will produce allergic reaction. Okay, now the question is what? Which amino esters will produce allergic reaction and why? There are two amino esters which are being metabolized to a compound called as PABA. PABA is nothing but para amino benzoic acid. So those amino esters which are metabolized to a compound called as PABA will cause allergic reaction. If you look at the spelling of PABA, you will come to know which two amino esters. Why? Because P and B I have highlighted of the PABA. If you remember that also, you can easily remember. P stands for procaine, can cause allergic reaction, and B stands for benzocaine, which can cause allergic reaction. These two local anesthetics can cause allergic reaction. Okay, so that's regarding what guys? That's regarding the local anesthetic allergic reaction. Now, whenever you give local anesthetic to the patient, there are some chances that it might cause some toxicity, but it will cause toxicity when it is given at a certain route. What route are we talking about? Remember, the chances of toxicity of local anesthetic is high when it is given through what route? IV, followed by tracheal, followed by intercostal, followed by brachial plexus. Okay, the chances of local anesthetic toxicity are high when it is given through the what route? IV route. Okay, now coming to what guys? Lignocaine. Lignocaine is a very important local anesthetic. With the spelling of lignocaine, L-I-G, you can easily come to know what are the important points of lignocaine. L-I-G. L stands for what guys? L stands for, it is the most commonly used local anesthetic worldwide. Very important point of lignocaine. Worldwide, it is the most commonly used. Okay. Next, I stands for what guys? I stands for, it is the most commonly used local anesthetic in IVRA. IVRA is intravenous regional anesthesia. Next, G stands for what? It is the most common local anesthetic to cause malignant hyperthermia. Now you will be wondering why he is telling G and telling malignant hyperthermia associated with G. G is nothing but Garmi. Garmi is a Hindi word for high temperature. So malignant hyperthermia, local anesthetic causing malignant hyperthermia is lignocaine. Local anesthetic safest in malignant hyperthermia, that is procaine. Okay, that's regarding what guys? That's regarding the lignocaine. Okay, now guys, remember when you are giving lignocaine, you have to give the doses you have to remember. The plain lignocaine dose is how much guys? The plain lignocaine dose is 4.5 mg per kg body weight, and with adrenaline the dose becomes how much guys? 7 mg per kg body weight. But if you exceed this dose and give to the patient, then what will happen? Patient will end up into lignocaine toxicity, and which system will get affected? It is basically the central nervous system. Lignocaine always affects the CNS, and the first sign of CNS toxicity produced by lignocaine is what guys? It is perioral numbness. If you give a high dose of lignocaine, slowly the patient will tell the doctor, I am having some numbness near my lips. If you neglect that perioral numbness, slowly the patient will end up into what? Tremors. If you neglect the tremors, patient will end up into what? Seizures. And if you neglect all these three symptoms, patient will end up into respiratory or cardiac arrest also. ठीक है. So remember guys, the most important toxicity of lignocaine is central nervous system toxicity. It will give you time. Directly it won't jump to cardiac arrest. Okay. Perioral numbness. Okay. But bupivacaine, it does no nonsense. It knows that if you give the like bupivacaine high dose, it will directly cause cardiotoxicity, producing arrhythmias and ultimately leading to what? Cardiac arrest. So bupivacaine induced arrhythmias are usually treated with the help of amiodarone. Again, guys, don't get confused yourself. Bupivacaine toxicity is treated with intralipid solution. I'm telling you, bupivacaine induced arrhythmias are treated with amiodarone. But the treatment of choice for any local anesthetic systemic toxicity is what? Intralipid solution. How much? 20%. Okay. Now, let us start this topic with this case. 17-year-old male patient presented to the ER with the complaint of pain in the right iliac fossa, diagnosed to have acute appendicitis, now posted for open appendectomy. It's not lap appendectomy, it is open. So, which anesthesia should be preferred? Local, spinal, or general? Come on, guys. Which anesthesia will you prefer? Local, spinal, or general? First of all, you need to have this understanding. Local anesthesia is given for small area surgery. ठीक है, small area stitches, local anesthesia. ठीक है. Spinal anesthesia is given exclusively for below umbilicus surgery done within 2 to 3 hours of duration. ठीक है. That includes appendectomy, hydrocele, hernia, and hemorrhoid surgery, anal fissure, anal fistula, or any diabetic foot, all can be done under what? Spinal anesthesia. So for this patient, which anesthesia is preferred, guys? Local, spinal, or general? As it is open appendectomy, if it was lap appendectomy, we would have gone for general anesthesia. But nowadays also lap appendectomies are done under spinal. But you need to remember, open appendectomy requires what anesthesia? Spinal. Spinal anesthesia we are discussing. Spinal anesthesia. So guys, remember, in regional anesthesia we are having spinal anesthesia, epidural anesthesia, caudal, and saddle. Whereas we are also